Good afternoon, everyone. Thank you for being here. My name is Lauren Williams. I'm one of the Adult and Community Services Managers here at the Columbia Public Library, part of the Daniel Boone Regional Library System. Welcome to today's Lunch and Learn. Today, we're going to be learning about the unhoused citizens in our community and the services being provided for this population, a very important, relevant topic. So I'm pleased to see everybody here in the room and on Zoom today. We have, like I said, people attending a couple different ways. So I have a couple Zoom housekeeping items for those of you online. If you are on Zoom and want to ask a question, we're going to be holding those until the end of the presentations. Go ahead and put those in the chat. We do ask that you use the drop-down menu and select that you want everyone to see your question so that you all can see what's already been asked. We appreciate that. For those in the room, I'll be walking around with this microphone during Q&A. Also ask that you really get close to the microphone when you're asking your questions so people can hear it. We appreciate that. We are recording this presentation, so it will be available on YouTube, the library's YouTube channel, as well as the League of Women Voters YouTube channel in just a couple of days. If you are in the room and would like, we have a program survey that's optional. You can fill out. We've got paper forms in the back, as well as the QR code that you can scan if you want to give us some feedback about other types of programs you'd like to see at the library. And I think that's it for me. I'm going to turn things over to Barbara Hobby with the League of Women Voters to say a few words and introduce our speaker today.
Thank you, Lauren. And we always thank the library for co-hosting these Lunch and Learn programs. I'm really pleased to see so many people in person. And I know we have about 70 or more people online. So I know this is a very important topic, not only locally, but nationally. So I'm very pleased that Carrie Utterback from the Columbia Boone County Health Department is here. And also Catherine Armbruth from Como Mobile Aid Collective, and she has also brought an assistant and sort of on the ground worker, Stephanie Yoakum, to present to you. And as Lauren said, we'll save the questions until lab, both online and in person. And I'll just tell you a little bit about Carrie. Well, she's with the Columbia Boone County Public Human Services project, our department, and she focuses on the homeless and maybe some other things also. She was also a 2019 diversity values winner. So thank you for all your work related to that. She graduated from the Missouri State University in 2007. And correct me if I'm wrong on anything.
Nope, you're
yes.
great. You're great.
Yeah, and moved to Columbia to work at the University of Missouri. In 2010, she began her career in public health and human services. She also led the city's diversity and equity and inclusion training program, I understand. And so we're really pleased to have you here. And then Catherine Armbruth is the coordinator or a coordinator for Como Mobile Aid Collective, which is a mobile soup kitchen and also supplies unsheltered residents with services and needs that are unmet otherwise. Catherine grew up in Little Rock, Arkansas. She has an MFA. Is that right?
Yeah, I'm like, how did you get all this
She has
information?
an MFA in fibers and sculpture, 2012. And a BA in anthropology, 1994. She is an adjunct assistant professor at the MU School of Visual Studies and teaches fibers also at Columbia College. And she was also previously the director of the George Caleb Bingham Gallery a few years ago, which is really great also. So with that, I'll give you Carrie Utterback.
All right, I feel like I should tell you about Jeff because we didn't get to her bio, but I would have to literally make things up. And I don't think that would be good.
We'll do it.
Okay, I do believe that she like trains dragons on the side in her free time. She likes to travel. No, I'll make sure we get your bio. Okay, so the city has made a new position to work on coordinated entry and homelessness in the Public Health and Human Services Department. But has been going on way before that. So I am in no way new to this work, and also this work isn't new. I'm standing on the shoulders of many people who have come before me and have been working on coordinated entry. So this position is new, but the work that is being done is definitely not new. So I'm not going to go through all these slides because there is a ton, and so I'm just gonna highlight what I want so that we can get to the meat and bones of the folks who are out there doing the daily work. So, let's talk about what makes someone homeless. Like what are the reasons someone might find themselves unsheltered or without housing?
Medical event.
A medical event, yeah, that's a great one. Job loss, yeah.
Mental illness without a support net.
Mental illness and without a support net, whether you have a mental illness or not, that support and connection is, and the loss of that is often what leads to folks being unsheltered. Is there anything else?
Affordable housing.
Yes, lack of affordable housing. That's a great one. Thank you so much.
Addiction.
Yeah, substance use. Access to affordable health care, sometimes domestic violence.
Yes,
Sometimes-
partner.
Yeah. Sometimes, disability. Sometimes it's incarceration, sometimes it's institutionalization, sometimes it's coming out of the foster care system. Like there's a lot of reasons that people end up either sheltered or unsheltered. And we know that we are, as within any system, oftentimes we have subpopulations that are overrepresented. And so our overrepresented subpopulations here are our veterans, our LGBTQ plus folks, people with disabilities, people of color, and youth in foster care. And we, across the state of Missouri, use the same kind of system to case manage folks. It's called HMIS, the Homeless Management Information System. And so we're able to understand that these overrepresentations are also issues that we can work on, right? It's not just homelessness, but we have to work also on these discrimination of these subpopulations. Okay. So we are doing a lot locally, which is very cool. She's my timer. She's supposed to be giving me updates. So, locally, we have the Boone County Coalition to End Homelessness. This coalition is a very large group of us that meet super frequently. We meet every 2 weeks. And we go through and case manage everyone who's on our prioritization list. So we use a tool called the VI SPDAT currently to see where people are at, what traumas they're experiencing, what housing would be beneficial, what kind of family members do they have, is there any disability, is there any health stuff that's going on. We also count how long we've been on the list. And so we try to categorize, are you chronically homeless or not chronically homeless? How long you've been on our list, so the length of chronicity, and then we count whether you're a veteran or not. And so those are all categorized and filtered, and that list, we go through that top to bottom every quarter, but because it's so long, mostly we get through about the top, everybody in the chronic list, which is about the top 50, not including veterans, and then we get through all the veterans. So, but we have 179 families on that list, 173 families on that list as of last week. And we have 40 active veterans on that list. We also have 48 open housing referrals, which means that we need affordable housing landlords to take vouchers, because we have 48 vouchers out and only 173 households. So that gets rid of almost a third, that houses almost a third of our population that would no longer be homeless if we could get someone to take their HUD voucher, right? So we at the Coalition to End Homelessness also get to organize Project Homeless Connect. And we are going to be restarting our landlord incentive program for folks who will sign up their property to take vouchers. But there's more to come on that, so don't email me just yet on that. The money is not available right now. Okay, so we do work through the coordinated entry process, which I just talked a little bit about, but our by name list or our prioritization list, like we know everyone who's on our list, we know their name. We don't always use their name if they are in an unsafe situation or would like us not to use their name. We use case numbers sometimes, but we are able to say they're having trouble finding housing. They would really like to be near this resource or this family member. If we could find them a one-bedroom apartment, we can give them a voucher. They have a disability, but they also have income from disability. Like this would be the price range. And then all of the case managers on that call, on that Boone County Coalition and Homelessness call, can help us problem solve, right? So it's going through housing plans and it's prioritizing the resources for our most vulnerable folks. So it's one of the most heartbreaking meetings because we have 173 households, right, that we want to house. Oh, it's one of my most exciting meetings that I get to go to because that's where I find out how many people are housed. And I get to highlight them purple and like put exclamation points on the data. But we housed 18 folks in November and 21 folks in December. So that is just so exciting. When I think about the cold coming up, that those folks are folks who are going to be able to be warm and those folks are going to be safe. So, okay. We are also super lucky to have the Columbia Housing Authority and have public housing and housing choice vouchers. They also do our HUD VASH vouchers. So all of our veteran housing, they do those. And they are a super great partner in that they also have properties. And they are really good about knowing all of the HUD rules, all of the HUD in and outs that we have to follow all the time. Camille is actually one of their housing liaisons and she is here. So if you have questions for CHA, she might be able to answer. She is the expert. Okay, we do have permanent supportive housing. We do this through our balance of state continuum of care. We do have some homelessness prevention and rapid rehousing. So homelessness prevention might be like eviction prevention or paying someone's back utilities. So their utilities don't get shut off, so then they don't get kicked out by their landlord or something like that. So we do have some rental assistance. It's not always available. They run out of funds and not everyone is eligible. But there is some rental assistance and that is at VAC, Love Columbia, and True North. We also have utility assistance at CMCA and at Public Health and Human Services. We have just been able to expand our emergency shelter to year round, which is really, really exciting. I think we're saving people's lives, like every night right now, especially. So we have the Salvation Army Harbor House. They also do some cold cots when it gets really, really cold. We have Welcome Home. That's for veterans. We have Room at the Inn, which is what I was just talking about. They have a capacity of almost 100 and they're going to be open year round now at the Ashley Street Center. I'm just so excited that it used to be only open December through March. And so like March 1st, like not even the end of March, like March 1st. So now that they are going to be open all year, I know that is just a huge, it took on a lot of capacity. And I just am really excited that that's a resource we have here. A lot of communities don't have that kind of emergency shelter open year round. We also have True North, which works with domestic violence victims, and then we have Flourish. We have Beatrice in the back if you have questions about Flourish or want to support them. They have capacity to work with youth and young adults for homeless. So it's also really great to have them because that was a gap that we had for years. So we have some harm reduction services. We have the drop-in center and the city's overnight warming center, and both of those are run by Turning Point. Loaves and Fish and Soup Kitchen. We also have on, are you guys still on Thursday night? There's a Monday and Thursday. There's a whole comment. I'm not gonna.
Okay.
So we have Loaves and Fish and Soup Kitchen, and we have the Comac Nurses Clinic on Thursday nights, and that is in conjunction with the soup kitchen. Monday and Thursday. Even better than I thought.
Yeah.
Also harm reduction, also just saving people's lives. And then we have the warming and cooling centers across the city. The library is a really great resource, and a safe space to get warm when they're open. So, appreciative to the library. And we have Trot. Laura is here, I see, from our Columbia Homeless Outreach team, with New Horizons. They also have representation from the VA and Rural Behavioral Health. And then Comac, they're going to talk in just a little while, but they provide street outreach to camps and all over town. They just drive around and find people, which is amazing because that's not something that's often offered in other locations of this side of our community side. But they also go to Room at the Inn. They work with all of the partners who are also working with our unsheltered population. So they're a great partner as well. Project Homeless Connect. This is coming up. We do the count with the Missouri Balance State on the same night across the state with the same tool. So we have consistency year after year. We pair our point in time count with our Project Homeless Connect, which is really exciting because it puts all of our access to services in one place for one day. Well, 2 days a year. We do one in the summer. And we get a lot of folks counted. So we get a really accurate count. And we also provide lunch and backpacks and supplies and things that are needed at that event as well. If you would like to volunteer, I think we're still taking volunteers. Check out our Project Homeless Connect Facebook page. Okay, I am gonna pass it over to Comac, but I want to point out that like, this is not, like the city doesn't pay for all of the initiatives that I just mentioned. Like the city, it coordinates efforts oftentimes. So, I mean, there is federal funds. I talked about housing choice vouchers. Those are often HUD funds. We have other federal programming to provide housing, like CDBG grants. We have state programs that provide harm reduction, local government programs like utility assistance and things like that. But we also have faith groups and philanthropic organizations and a lot of private donations. So when people say like, who's paying for all of this? It's like, well, everyone. Like, this is a lot of folks. There's a lot of folks involved in paying for all of this. Okay, I am going to pass the mic.
Can we clap? Good clap,
There
Gary.
you go.
Good clap. Hi, can you hear me in this microphone? Hi, everybody in the virtual world too. I'm Catherine Armbrust. I'm the director of Como Mobile Aid Collective. This is Steffi Yoakum, who is our operations manager. Steffi has also been doing the door for over 4 years at Loaves and Fishes, and also helps Ruth O'Neill, who is the leader of Loaves and Fishes, with the organization of that, because there's a lot of stuff going on with Loaves and Fishes, which is the evening soup kitchen here in town. So she's been in this world a really long time. I actually, like Barbara said, come from the art world. And one day I'm like, can't even believe I'm sitting at this table right now. And I blame that on my friend Dirk Burhans, who's back there. I met Dirk in the summer of 2020. We were both doing some social justice activism work. And he mentioned to me, oh, I do this mobile soup kitchen in the winter. I always love to have extra help. And I was like, oh, okay. And in February of 2021, if y'all remember, we had 2 weeks in February that was really like horrible winter. And it was really scary. So I messaged Dirk, I want to help. So I started going out to serve lunch with him. About that time, we were serving about 30 or 40 people. Around that time too, I realized that Wabash bus station was used as a warming center overnight. And I started going there and ended up meeting staff there. And then all these other like amazing people that were already doing this outreach work. Winter ended and Dirk was like, okay, like the mobile soup kitchen is done. Thank goodness warmth is coming. And my friend Kelsey, who was helping me, we decided we wanted to do this year round. And now suddenly we're a nonprofit and we're doing a lot of really amazing things. But sometimes I can't believe that like we're here and that this is happening because we've grown so much. Not only do we currently, because it's winter, we have a mobile soup kitchen that runs Monday, Wednesday, and Friday. We're serving approximately 100 people per run right now, both in the downtown and sort of surrounding areas, people that are living in camps, and thank goodness, people that are living in room at the inn now, which is truly saving lives. And I'm so grateful. There are a couple of people, especially that I was counting down, literally counting down the days till it would open because I knew that they would go then be able to go there and not sleep behind a dumpster anymore. In the winter of 2022, we had a friend who was sleeping at Wabash Warming Center who had a burn on their foot from a hand warmer that they had put against their skin. Can't do that. My friend Gail, who happened to be a nurse, was dropping off some backpacks and hey Gail, you come and look at this burn real quick. And then suddenly I literally don't even know how it happened. We just suddenly had a group of volunteer medical professionals that put together a pop-up clinic at Wabash and started coming. Steph and I were going there pretty much every night with other volunteers. And then when that sort of season ended, the nurses were like, we want to keep going, and started a pop-up clinic at Loaves and Fishes, which we now do 2 nights a week. We see probably about 40 to 50 people a night for first aid, a lot of wound care, and other kind of hygiene. We have thrift store Thursday, so they can come in and get clothes. Then our nurses and other medical folks realize, man, people really need to go to the doctor. We should start making appointments for them. And so now we're making appointments for everybody and working on transportation to get them there. This is a really serious issue, but we're all pretty like fun-loving people. And so we like to infuse the work we do with a lot of joy and bring a lot of like heart and love to our work. We have, I don't know, in the winter of 2022, we decided we needed some hashtags, and one of them is strong work, started by Dirk, who I think appropriated it from Renee. But that's when we, instead of saying great job, we say strong work. My mom has actually started saying it now, which is hilarious. Our other one is big love, because we put a lot of big love, and then full tang, because we really go like full in. I kind of describe us as like our mission is outreach, right? And we are filling the gaps that these other services might have more financial or maybe other restrictions that they have to follow. And so we sort of look for those gaps and try and step in to see how we can help and how we can connect people to the other resources that are established that can get them into housing or other types of social service care that they might need. Our 2 medical team leads also happen to volunteer for Unchained Melodies. And so they got us hooked up, and now we're able to offer pet care like flea and tick treatment, spay and neutering, and food for our pets that are on the street with our friends, because that's really important that people's pets are well cared for too. I mean, what we do is really huge. Like right now, our winter outreach team Steph is the lead of our winter team, and we're out every night calling people, trying to get them to go to room at the inn. If Wilkes is open, which Wilkes Overnight Shelter is thankfully open all week. That has been a huge shift from people having to sleep on the floor at Wabash, which was no indoor bathrooms. We had to essentially force the city to open the porta potties that were outside, that you had to go outside in the middle of the night in the freezing cold to go get to, with no snow or ice removal. But anyway, that's another story. But folks being able to go to Wilkes Warming Center overnight has been a huge boost for safety, for like, we're able to focus our work on other places now too, but our teams are out there every night, and this week is a scary week coming up. So we've got a lot of stuff that we have going on. What else do we need to talk about? We're just like I feel like we're growing constantly and we're making connections. So like, I'm gonna just point out Camille. Camille's from the Housing Authority. In the front row, the Housing Authority established a new position that's like a homeless outreach person. Camille goes out with me on meal runs once a month and talks to the folks that are out to see if they need help getting connected to housing. I see a lot of our volunteers here actually, and like we're literally powered by volunteers. And so I think everybody that's online and here, we have really amazing community support. And I'm so grateful for that, because it's really important that we all work together. We focus on what's called mutual aid. And so essentially that's shared resources, right? Like if we can't help somebody, we're going to start to look for somebody that can help them. And we also have a lot of commercial sponsors, like restaurants around town, that either give us ingredients or prepare meals for us to take out to our friends so that they can get a hot, hearty meal in the winter, and maybe a cool meal in the summer. But we've got a lot of work to do, and I think we would all like to just kind of answer questions. I don't know if I covered everything, but please ask.
I feel like you definitely did not give Steffi time for a bio.
Is this
More about Steffi, but also they provide like water delivery in the summertime, right? So like when we need people to stay hydrated when it's just so stinking hot out, like, and there's no relief even in the evening hours when folks are camping, like their volunteers provide water delivery.
We have an aqua squad in the summer. Everybody has like team names. We were laughing about that this morning, but yeah, winter warriors are in effect right now. We're like, winter warriors activate. And then in summer, we're like, aqua squad activate. So
They're Power Rangers.
yeah.
So thank you so much, Carrie and Catherine, and we're gonna go to questions, and I thought I'd ask the first one. And that is congratulations on getting $30,000 through Como Give.
Oh, thank you.
Como Collective, and to everyone who donated to that.
Yeah,
Also.
thank you.
My first question is, what else can people do to assist or help monetarily, or if they want to volunteer, or and what needs do you have in particular?
So, you want me to do it? So there are a lot of different ways to be involved. We have pretty specific volunteer opportunities right now. And if you are interested, just, we're on Facebook, we're on Instagram, we have a website, comomobileaid.org. Send us a message. We can send you, I may have gotten a little obsessed with using Canva to design graphics. In fact, one of our friends just had a dream about me designing a graphic for my toaster. Anyway, that's fine. But you can message us and we can send you some information about opportunities. We always need kind of what I'm calling like meal partners or pantry patrons, where you sponsor a certain part of the meal, either monetarily or you provide chips or fruit or cookies. So like today, Como Smoke and Fire is serving up barbecue sandwiches. We had our team helping the restaurant make sandwiches. We had somebody bring in fresh fruit. We've got chips, and then we've got some dessert. Some people make homemade desserts. Some people just provide packaged snacks. So you can be that kind of sponsor. You can just throw money at us. We love that too, because like we use that money to buy tents, to buy water, to buy so many hand warmers. we, if you want to do some sort of either fundraising drive or supply drive for us, we can give you kind of a focused drive to do. I think the public defender's office just did a little drive for us, and I sent them a very short list of things. Like stores do that. Clovers is so amazing. They do little drives for us a couple of times a year. Or you can volunteer to help us organize donations. You could come, and if you're really interested in direct action and getting involved with people, you can come train to be a winter warrior or an aqua aide or a med clinic greeter or something like that. We have a variety of positions. One of our dreams at some point in the future is to have pet care services for folks so that they can come in out of the cold, because that's a massive problem that is not covered yet. That's a gap that we have not been able to fill yet, and that is definitely problematic here, is that we have people who are staying outside specifically because they have animals and nowhere to take them, because we don't have a shelter in town that will take them. There are some hotels, but right, like you still have to get money together for a hotel. So, we have a really beautifully rounded out med team right now. And we also have a contract with the Mizzou School of Nursing, and we just signed a contract with Stevens School of Nursing too. And we have interns from those schools coming in and working with us in our clinic, which has been really, really amazing. So we're trying to work on more student opportunities as well, because I think that is really important to engage younger populations so that they can take over the work, hopefully, right? Am I missing anything?
That's pretty thorough. Well, yeah, we have a question in the audience and from the audience, and then at least
We got a
more
card here too.
online. Do you want to read that question that you were given, and then we'll go to the audience.
We already answered how you can get involved with Como Mobile Aid. Holler at us. Are there any dental clinics?
So by dental clinic, I'm assuming that you may mean someone with no health insurance or only Medicaid, in which instance there's only 2 providers in town who offer dental services for public insurance, and it is Jordan Valley / Clarity Dental, and it is Compass Health Dental. Compass recently opened a walk-in dental clinic in the mornings on weekdays, which has been really cool. Their Providence location is under construction, but their Keene / Berrywood location is where they can see folks who do not have private insurance. And Jordan Valley Dental, I believe 1 to 3 p.m. in the afternoon is a walk-in clinic as well. I believe that is also every day of the week, but those are the only 2 providers in town who accept, public healthcare benefits or dental providers.
Can you enlighten me as to finding the gaps? I'm curious about, because Remedian serves a meal, Loaves and Fishes serves a meal, and there are several of these. So how have you identified where the gap is? And my guess is that you're pretty strategic about not trying to replicate what's already been done and partner with somebody and refer people. And so I'm just curious how, especially feeding people, that what we have out there wasn't sufficient, and how you identified that you could come in and fill a gap. Where was that? And so,
well, Dirk identified that, but those all serve evening meals, and we do lunch.
okay.
So the Salvation Army Harbor House also offers a kind of a walk-in lunch, but that's actually really hard to get to because of where that location is. And when you're camping on the edges of town, like it's really challenging, especially with our bus system now. It's 90 minutes in between buses. And that's a really long time to wait in the cold or the heat. And so being mobile to meet people where they are, like, because we're not in a fixed location, we're out moving. That was like our original intention. And Dirk might be able to answer that too.
And just to add to that,
Giving the mic.
putting together a meal 2 or 3 times a week in the winter and 2 times a week during the rest of the year is very labor intensive on our side. it would be great if we could do that 7 days a week.
Mhm.
And like Kat says, the Harbor House is out of the way for a lot of people. So being able to take it directly to people on the street or in the camp, 7 days a week, would be a huge increase in person power and resources for COMAC, but would be optimal. That would be a gap that we can't do it 7 days a week.
I think I wanna like also cabbage onto that, in that there's a gap in terms of safety of people's possessions, because there's not really a place for people to leave their stuff, and if you leave your camp to go do errands or to get a meal or something, you're at risk of theft. And so a lot of people, like we have people that send one person from camp out, and then they take stuff back to camp for folks when they need them. So that would be really hard to come into town for something like that as well. So I think us being mobile is one of our true strengths.
We are also still looking for a permanent location for Loaves and Fishes.
Yeah.
So that will be a huge gap. If someone has space with a commercial kitchen, we would love to talk to you.
Yes, because as Loaves and Fishes is needing to leave Wilkes soon, that means our med clinic is gonna be without a home as well. That's gonna cause a huge problem for accessibility for people, for us to check on them, do their wound dressing. And that's kind of a similar issue with camp evictions. These constant disruptions in the camp communities means that accessing people and finding them is much harder as well. For all of the like social service outreach people, it's really challenging.
Thank you. One of the questions was about loaves and fishes, so that was answered. Thank you. Another question, well, actually two questions from online related. What is the size of the homeless children population? And is it true that there are about 40 homeless kids enrolled in Battle?
So,
Go ahead. I mean, when I talk to
Stop here. Yeah.
when I talk to CPS, they're saying it's like over 200 kids. And a lot of times those families are doubled up. Which just means there's like 2 or 3 families living in one location. And HUD doesn't consider them homeless because they have a roof over their head. So,
Which can be a hotel, right?
which can be a hotel, yes. So, and we have in that population who are also really scared for the school to find out that they are doubled up or they're homeless or living at a hotel for fear that they'll get their children taken away. I believe that those numbers are really underreported in honesty, but CPS is over 200.
Great, thank you.
I think Steffi was gonna.
Oh, go ahead. Did you look? Okay, another question from online. Do you pick up unused food from restaurants and dorms?
That type of gleaning program is something we're very interested in. And actually, from what I understand, when we had a long conversation with the food bank last year, I don't know, what is time? They actually have plans now that they've shifted this facility. They want to kind of start a gleaning program like that and then have free space to store for programs like us to utilize. So we don't have that in place necessarily. We do have people that offer us food sometimes. We definitely have restaurant, like Beatbox is amazing. They're like, hey, we've got a bunch of chicken biscuit sandwiches left over. Do y'all want to come pick them up? So we do that a lot. Cafe Berlin does that too. Pizza Tree, I gotta go pick up like an 8-pound block of cheese from Pizza Tree today. They're so awesome. Or Goldie's, you know, we have all these wonderful small restaurants that do that, but that's on the horizon and something we want to do. I worked at a women's shelter in Kansas City for a while, and there is a wonderful program called Harvesters that does that there, and I would love to see something like that here.
Thank you. Let's see, we have another long one online. I'm gonna hand it over to the person who's monitoring that.
Carrie mentioned 173 families earlier, but what is our current census number for unhoused individuals in Como? Does this include those outside the HUD definition you mentioned, like those living in hotels or couch surfing?
That number is not available. We don't have any way to count people who are doubled up or tripled up or quadrupled up, or if there's two families living in a hotel room. We don't have a way to count that currently, and we don't. We, like I said, a lot of folks with kids try to hide that they are experiencing homelessness. So it's really hard to count them. I can tell you that the 173 households on our list is not all encompassing. We have people who have been on the list and who have given up, and so they don't want to be on the list anymore. They are just really downtrodden about being a part of a system that is broken. So when I say 173, that includes people who are sheltered. It includes people who are not sheltered. It includes people who need to be on the list and need resources. And it doesn't include people who are at a shelter, who no longer want to be a part of the system, but who are still looking for housing. So we don't have an all-encompassing number, right? And part of that is that we don't have the resources or capacity to count those folks. And part of them don't want to be found, and part of them don't want to be counted, right? So I know that that is a really long-winded answer, but also I don't have an answer for you. I know the number of actual people on our list is 234. And so that makes the number of, single person households approximately 80%, and that's pretty steady. And that's what we hear from our partners too, is that 1 bedrooms are what is needed. Oftentimes if you're a single person, that's all that you're about for looking for too. So it gets really complicated when we try to define homeless, and then when we try to count those folks who are homeless. We have a question from the audience.
Okay, hold on a second. Let's give you a microphone. And do you want to come up here? Or
So I was just wondering, you mentioned that parents, often feel like reporting that they're unhoused and that their children are also outside. They're afraid they might get their kids taken away. Is that a real threat?
Yeah.
Oh, God, yes.
Oh, God, yes. So CPS wants, oftentimes the kiddos aren't at a camp.
No.
Oh, no,
there's-
no. We
there's-
don't have
I
kids in
want
the
to
camps.
clarify, there's not kids living outside in these elements, okay? Like, to see a minor out in the camps is unheard of, and I believe in like the few instances we've ever seen it, like, we reported it. So to tag on to, there are very different kinds of homelessness. The mentally unwell single individual in the woods who has been surviving outside since they were 13, living just north of town, who can pretty much take care of themselves, is a lot different than the parent with 3 kids in that weekly rate motel room who is like barely scraping together.
In that hotel room, that's so in danger of having the kids taken away.
So CPS would like folks to report it so they can be sure that there's not an interruption in their school services. Because even more children use the school systems for food. So CPS would like to be able to send a bus from school to get those children when they are living in a motel. So CPS isn't necessarily going to report you for living in a motel. CPS is if they're safe,
Yeah.
right? They're worried about safety.
I do want to clarify that Jane Williams of Love Columbia has given numbers before, and to her knowledge, about a year ago, CPS had almost 20 different stops at different weekly rate motels in town. And before COVID, it was, I believe, under 5 stops at hotels in town. And that number now is, again, over a year old, is probably over 20 different stops they're making a weekly rate motel. And most weekly rate motels, which are single room occupancy, which we desperately need, are full of families really crammed in there. It's pretty rough.
Well, in fact, Love Columbia, like 2 weeks ago, just highlighted a family that had been in a hotel for 2 years and they just got housing, which
Most
kind of cried
weekly
when I
rate
saw that.
motels in town are actually very expensive, very rundown single rooms that are often being subsidized by people like VAC and Love Columbia, just keeping those families in there with the roof over their head.
Because
Without
there's
any
no
food prep
affordable
area.
housing.
With no food prep area, yeah.
Okay, we have another question from online. How do you define family? What is a family? Homeless family,
A HUD family?
homeless.
Sure, how would anyone define a family?
Well, I guess you might wanna say it's all inclusive, or if this is,
I guess,
I don't,
like, if a
Yeah.
family's getting a voucher, does that means that they need to have minor children or something? Or
No, it could just be a couple, right? It could just
that's
be a
like,
couple.
yeah, I think that's.
Yeah,
the
so a
question is,
family
like,
could just be a couple. It can be a dad and a child. It can be,
like two partners.
yeah, a mom and 4 kids. Like it could be anything. And, yeah, HUD includes LGBTQ folks, if that's what they're asking.
Maybe.
It even includes folks who are not married, who need to live together. Yes.
Yeah, I'm sort of thinking that's what the
Mhm.
question was asking. It looks like we don't have any more in-house.
we had one more online that was on this little piece of paper here that
Oh,
said, how
okay.
is Como Mobile Aid funded, which is an important question to answer. We came from scraping together from our friends on Facebook to moving, getting our nonprofit status in September of 2022, so that we'd be eligible to apply for grants. So we are funded by community donations and by grants that we apply for now as well.
I want to clarify that just because we are funded doesn't mean we are properly funded.
I think
Our
everybody gets
medical
that.
clinic is very impressive and it is staffed by nurses already working 50 hours a week. And we're doing medical appointment setting, medical appointment transportation. Some of these nurses are also tracking wounds on some of these individuals that can last a year. Ulcerated diabetic wounds outside in these elements. And frostbite actually can take up to a year to heal while the doctor determines if your tissue is gonna make it or not, or if they're just gonna completely amputate. And it can be burns.
We have a
We have
really,
someone with extensive 2nd and 3rd degree burns all over their body right now. We do have them in a motel. That's what some of your money is going for. I mean, we try and spend that money very judiciously, but extreme medical cases where it's not safe for someone to be out here, it's all over their body. It's on their hands, it's on the entire, like their back. And yeah, they went to the ER after having the same bandages for 4 days yesterday, and the ER sent them away with just more bandaging. And so a lot of the time, maybe the patient might not know how to properly take care of their wound or might not have the ability to do it in these elements. Med clinic is right there. Qualified nurses, at least making sure those bandages are checked, getting eyeballs on, everything like that.
our nurses and they actually go out and meet people if they can't come to.
Oh yeah,
clinic.
Nurse Gail and
do
Nurse
wound-
Lake will be at this person's hotel room at 2 p.m. today to get their stuff changed. Like we are at full service. I'm very proud of that, but it's all volunteer ran. It's very exhausting. It's not fully funded.
We did just get some ARPA funding from the city that is going, thank you, and thank you, city. That's going specifically for outreach services, which we're really grateful for, because we need that. Like, we're literally all volunteers, so we need that support, and that's gonna be a big game changer for us. So thank you for that.
Thank you for those details. We do have one more online question. Can you share the typical rates for weekly rate motel rooms? And who are the owners those motels, I don't know, maybe who I, whatever. Hotels may or may not wanna say that. And then, the person says this might be a good newspaper story.
So all have opinions on predatory business practices. Okay, there's a difference between optional and compulsory. I would say a bare minimum of a weekly rate in town in a very poor room. These buildings are constantly being sprayed for roaches and bed bugs. I will not name names for a variety of reasons, even though I wish I could. They are not very clean either. Minimum of 300, 325, 275 a week. The absolute cheapest in town, if you want to pay for the entire month and you have your disability check and your stuff really together, you are looking at just over about $900 a month for a room in town for 30 days. Well, most disability checks are about 900 and some odd dollars. So they pair up, but you have to hope that the person you share a room with isn't predatory.
So when you see people out flying signs, a lot of people are really trying to get their hotel room money so that they can stay inside, especially right now in the winter. People who are in camp sometimes do want to go inside in extreme weather for the winter, and so like there's a lot of different opinions about, well, I'm sorry, when we say someone's flying a sign, that means that they're out perhaps panhandling might be another way to look at it. But a lot of folks who live in these motels, in fact,
Many near the intersection.
James
We just lost the gentleman.
Allen, who was just hit by a car and killed.
The dark black man at 63 and 70, who's been around for years with very white facial hair, was hit and killed by a driver. Like, and we lost a second person in that same week from being hit and killed by a driver. And these are just the ones that make the news. People get hit by vehicles all the time. It's very rough.
But that James has essentially been living off and on in motels, and so he'd be out there flying his sign to supplement his check and be able to have a safe place to stay. He was 78 years old.
And he'd been at that intersection for a long time. You may recall his face.
And he was at Providence and I-70 for a long time too, because he was staying in a hotel over there as well.
So, Carrie, you want?
Yeah, we actually lost 25. Is that what you said?
Or 25.
I think James made it 25.
I think so too.
Because that was, so we do a memorial service every December, and we were, I think, at 25, and then he was hit after the memorial. So I'm almost positive it's 26 people we lost in 1 year that were either homeless or experienced homelessness in that year. And that's a lot of people. That's too many,
It's about 2 per month, which is pretty rough.
which, yeah, right? Like, I think John puts it really well when he says, like, if this were any other public emergency, like, we would have fixed it. There'd be an antidote. And we know the antidote is housing. So we know that we get people off the streets, they're not gonna be hit by cars, right? So all it takes is more affordable housing and supportive services. But if we can get them in a home, oftentimes people are more acceptable to support.
So before we thank our speakers, I want to announce that our next Lunch and Learn program will be February, a Thursday, not a Wednesday, February 15th, and it will be on the topic QAnon from fringe conspiracy to global political phenomenon. And our speaker will be MU sociologist Chris O'Connor. So I hope everyone will join us. And I want to thank, and everyone here to thank Carrie Utterback, Catherine Armbruth, and Steffi Yoakum for all their work and for being here today.
So much for everybody online and for caring about this issue. It's a really hard issue to talk about. And I want to say that, like, the more we talk about it, that makes it more visible. And it's hard to look at this kind of stuff, but we can't look away. So please look towards it and figure out how you can participate as part of the community too. Thank you.
Thank you.